good afternoon. Today we are coming live from Doctor's Plaza. Yes, our town branch, our Tenri Embu town branch here at Doctor's Plaza building. That's where we are located at the town branch. So we welcome you to the Talk to Your Doctor show where we are coming live. Today we are talking about a mammogram machine, which you can see it is just right here with us, and we have our radiographer who will be telling you what is a mammogram and what are the uses of a mammogram. Everything and any question that you have about a mammogram, maybe you have a breast issue, you can ask Daktari and he'll be answering all your questions live on location right now. So karibu sana to Talk to Your Doctor show. Keep asking all the questions and everything shall be well. Karibu sana Daktari to the show.
Thank you so much.
You can introduce yourself to the viewers and then we continue with the show.
Thank you so much. My name is Maurice Mogo. I'm a radiographer at Embu Children's Hospital, and I'm here today to present to you about the mammogram. Yes.
So we can go, actually, you are a radiographer by profession.
Yes.
And you do a lot of things, not only mammogram,
Yes.
the other things you do like CT scans, ultrasound, x-rays, and all of those, we are doing them at Tenri.
Yes.
But today we talk about a mammogram because I think in Eastern region, we are the hospital with a mammogram,
Yes.
whereby people can come in, they should go to Nairobi to go for a mammogram service.
Yes.
So we are here to explain to them so that you can understand what is a mammogram, what is it used for, and so that they can understand better, so they can come for this service here at Doctor's Plaza. So what is a mammogram?
Mammogram is a radiological imaging examination that is carried out to check on the breast's pathologies. So whenever you have a problem with the breast pathology, then you use the mammogram. Although there are other modalities like ultrasound and MRI that you can still use to examine the breast pathology.
Okay.
But mammogram is the best to diagnose the breast pathology, especially if the patient has something to do with the breast lump, breast pain, swelling, and many other. So there are two types of mammogram. Number one, we have what you call screening mammography, and the other one is the diagnostic mammography.
Yeah.
So I'm going right away to talk about screening mammography. The screening mammography is examination that's done for a client, not patient.
Yeah.
So the client will discuss about the issues of their breasts with the doctors. The doctors will maybe physically examine the breast for the client. Then, if the doctor suspects there is nothing that he feels within the breast, then can send the client for last screening using the mammogram. These patients are asymptomatic. They don't present with anything concerning their breast, but they just want to screen to know whether there is anything that can be detected using the mammogram machine to be able to know about their breast condition.
Yeah.
Then there is the diagnostic mammography. Diagnostic mammography is the radiological examination that is carried out with this machine, which is a low dose imaging for patients who are symptomatic. Now this one is not done for client, it is done for the patient.
Yeah.
So the patient, they have the symptoms, now they present themselves to the hospital. The symptoms that the patient have for diagnostic mammography, they are like breast, nipple discharge, breast lumps, maybe pain, breast pain, and many other.
Yeah.
So if you have such symptoms, now you present yourself to our department here in Embu Children's Hospital, and we'll be able to carry out the examination for you to know whether this kind of symptom or presentation that you're having, whether they are cancerous or they are benign tumor.
Yeah.
The cancerous one, they are the cancer or what you call malignant tumors.
Yeah.
So those ones are cancer. But there are those ones are called benign tumors. Those ones are non-cancerous.
Okay.
Yes.
So what is the difference between having a breast ultrasound and having a mammogram?
There are those tumors when you do the mammogram, they cannot be defined by the mammogram.
Yeah.
So whenever you see such problem or the patient present with a lump that cannot be accurately diagnosed by the mammogram, then you send the patient for the ultrasound. Ultrasound is able to diagnose such problem. And again, ultrasound does not have ionizing radiation, but the mammogram has the diagnosing radiation.
Yeah.
Yes.
Maybe there's someone out there they maybe could be willing to do a mammogram. So how should they prepare to do a mammogram?
Preparation.
Yes.
It is important that a patient discuss with their doctor about their breast condition or breast feeling, breast signs. So for you to prepare, it is important to note that it is not good to do the examination 1 week before your menstrual periods. But you can do it, we usually recommend our patient to do it 1 week after the periods, because before the breasts are tender.
Yeah.
So at that time now, at least the patient, their breasts are okay to be compressed during the procedure. So that's only the preparation that we carry out for mammogram.
Yeah.
Yes.
So now I can see the mammogram machine.
Yes.
So how is the procedure performed?
Thank you. Now this is the machine. This is the mammogram machine. Usually the patient stands in front of the machine. Then the patient places the breast on top of this plate.
Yeah.
Once the patient position the breast here, then the radiographer, like me now, we use these other plastic plates to compress the breast.
Yeah.
You can use, there is these buttons here.
Yeah.
You can see it is compressing. So once it is compressed, now you start operating. Whatever you want to take, we usually take like the basic views that we take during the procedure. We take 2 basic views. That is, one we call it craniocaudal view. The other one we call it lateral or mediolateral oblique. So when they do like this position, when the machine is at 0 position, you are taking out the craniocaudal view.
Yeah.
But if you want to take now the mediolateral oblique, you rotate the machine. The machine can rotate either when you want. Yes, you see like the way it is rotating. Now you want to take the breast, the left breast, you rotate it that side. Then the opposite side, you want to take the right breast.
Yeah.
You take it at 45 degrees, then you're able to achieve the best images that you want to send to the radiologist for evaluation and interpretation.
Yeah.
Yes.
Okay. So what if someone is short? What do you do?
If someone is short,
Yeah.
the machine is able to move up and down. So there are these other buttons that you can move the machine downwards. See the way the machine is moving downwards for shorter people.
Yes. So it can
Like
go
in
even,
Birikimo.
yes, we can
Then
go
for
down
shorter,
there.
for tall people like you, then it can go as high as possible.
Okay.
Yes.
Is mammogram painful? Just asking.
No, mammogram is not painful. Only that someone will feel some discomfort during the compression. When you're trying to compress the breast, and you feel some discomfort and some bit of pressure, but it's not painful.
Okay.
That's the only thing that you experience during the procedure. Yes.
So that is what actually we experience. Actually, that was the next question I was about to ask. Is there any pain or the experience during the procedure? So it's only maybe some pressure pain.
Some
And
pressure
after-
and maybe the discomfort. Yes.
Okay, I see the mammogram machine is very important,
Yeah.
especially for, you've not told us the age who are supposed to be checked by the mammogram, because I understand it's not all ages who are supposed to be checked by the mammogram.
Yes, it is important to note that mammogram, it uses a low dose ionizing radiation. And you know radiation is not good. People say radiation is not good. But now we have to look at maybe the advantages and disadvantages of using the machine for diagnosis. So the age bracket that we do for the mammogram is from 35 to 39. But from 35 to 39, you can do a mammogram unless now there is any presentation of maybe or symptoms. But the age that is recommended for screening purposes, you can start screening from age 40 and above. That one will be okay. Because of course you have to avoid ionizing radiation when you are below that age. Because you know it's a very tender age of reproduction. Yes.
So that means an ultrasound is not using radiation.
Yes, ultrasound is not using radiation. So what we do, if we think that maybe there is need for diagnosis of a patient who is below that age, then we use ultrasound to evaluate whether there is any breast lump or the cause of the breast pain and all that, breast or nipple discharge and all that.
Okay.
Yes.
Okay, now we go to what are the risks and what are the benefits of a mammogram?
Wow.
Yeah.
Mammogram is so beneficial to us. Number one, it is able to diagnose the breast pathology or the breast tumors.
Yeah.
To be able to differentiate between the breast or the benign breast tumor and the cancerous or the malignant breast tumor. So the benefit is that once you do the mammogram, you are able to differentiate between the two. That is non-cancerous and that is cancerous. And once you detect the cancerous one, or even non-cancerous, you are able to be treated.
Yeah.
And once you're treated, then you get healed and you're okay.
Yeah.
Yeah. Then the risk is just maybe one. That is, you absorb some ionizing radiation. And you know, radiation, as I said before, that it is not good to absorb a lot of radiation because prolonged exposure to radiation still causes cancer. So you have to look in between the two. That mammogram, on the other hand, it's helping you. On the other hand, if you have to diagnose cancer in early stages. And you know, as tradition, any disease, when it is detected in early stages, it's easy to cure. Is not done, like even the mammogram or chest X-ray, something of the sort, then the mother will not be able to be treated well. Because if, for instance, if that mother had a breast cancer, and then this breast cancer had already migrated or had already metastatized to the chests, you see, the mother chances of survival may not be okay because the mother already, the cancer cells have already metastatized into the lungs. So of course you have to do the mammogram if the doctor really finds it important. Although there is a protection that we do. We have a protective measure. We have a lead gown that we cover the mother. We make sure that we cover the baby completely. So you see the breasts is up. So there is a way we cover the belly with the lead gown to protect the baby from getting ionizing radiation. Although now, as I say, we discourage it so much to do the mammogram. But now we have to weigh the advantages and disadvantages.
Okay.
Yes.
So now we can maybe talk of the limitations of general limitations, not only for the pregnant mother.
General limitations.
Yes, general limitations.
Oh yes. Number one, it's the one that we've talked about for
Yes, yeah.
for pregnant mother. Pregnant mother, as I said before, they are limited in performing the mammogram, and then for those people with the breast implants, then those breast implant they will cause maybe the blurring of the images.
So what is breast implant? What is breast implant?
You know, there are those people who does some cosmetic work within their breasts. Yes.
Okay.
You know, they
Yes.
so if they do the cosmetic work in their breast, then of course they will be limited in performing the procedure for mammogram. Remember, during the procedure we have to compress.
Yeah, sure.
You have to compress the breast. And when you're compressing and then someone maybe had put some implant inside you, you know what will happen. You know what will happen. And also, the images will not be okay.
Yeah, sure.
The images will give a false positive information, false positive information to our radiologist, whoever is reporting.
Yeah.
Yes, so we have to make sure that if you're coming for the procedure, you don't have those implants.
Implants. You
Yes,
remove them if
you're
you have
clean.
them.
If you remove, you can even remove them. If you have
If they are
them.
removable.
Yes, you can
Okay.
even remove them.
Okay.
Yes.
So it's very important for women to have a mammogram.
A mammogram.
A mammogram,
Yes, yeah.
especially from age 35.
From age 35. Let's just mention age 40 and above.
40 and
But
above.
now, remember, there is this family history. If there is a family history of breast cancer in your family, then please at age 35, you should start this screening. Yes.
Okay.
And also, if there is also confirmation of breast cancer in you, and you are below the age of 35, then of course we want to do the mammogram to confirm the extent. Maybe after treatment, maybe after therapy, we want to know whether the mass has completely healed, has completely gone, or it has even grown bigger. Whether there is positive response. Yes.
Someone else is asking,
Yes.
is there a possibility of having breast cancer without having a tumor?
Yes.
Without having a tumor
Without-
inside the breast?
Without having a tumor.
Yes, in the breast.
No.
So there must be something.
Unless we are talking of the one that we call leukemia. That's blood, the blood cancer. Now you know the breast still they have the blood in them.
Yeah.
So unless you're having that, then the rest for the cancer of the breast you'll experience the tumor.
Okay.
And that's what I'm saying. In early stages, at least the mammogram will be able to demonstrate those small tumors that cannot be palpable. That is why now it is important to do the screening rather than to come for diagnosis. You know, when you're coming for diagnosis, already you have the symptoms in you. Maybe the way I explained before, you have the breast pain, you have maybe the nipple discharge, you have those lumps in you, and many other.
So when you have breast pain,
Yes.
could there be a tumor inside?
Possibly there could be, yes. And that is why now we recommend we do a mammogram to evaluate. Because you're having breast pain, right? And then during the physical examination for palpation, you are not, maybe you or even you as a client or even the doctor is not able to palpate the mass. When you do the breast mammogram, then it will be demonstrated. It will be demonstrated, yes.
It will be demonstrated. And you say that if it is diagnosed early, the better. The treatment is really smooth.
Yes. Any disease, when it is detected in early stages, the treatment is even easy. Yes. Than when, for the cancer, remember, these women, they want to be cosmetically smart. When when this tumor is small, the cut will be small when you remove this tumor than when the tumor grows. So you see, sometimes you have to be done what you call mastectomy. You have removed the whole breast. And you see women, they want to look presentable.
Yeah, they
yes.
want to show off. Nice.
Yes.
So, This machine has been here at Doctor's Plaza.
Yes.
And Tenri is doing it.
Yeah.
So you can tell our viewers the final words as you're completing. Could there be anything we've left out about a mammogram? And maybe tell them other things you do that can maybe do their diagnosis.
Okay.
Yes.
Maybe the only thing I can tell our viewer is that we are having a mammogram here in Doctor's Plaza, Tenri, Embu Children's Hospital, and we welcome you all for the two types I've explained about the screening. You can come for the screening, and if you have the presentation or symptoms of the breast pathology, then you can visit us. We'll be able to help you. We work here 24 hours from Monday to Sunday, so whenever you have problem, you can visit us here. For those who are having NHIF, you can visit us. Actually, the NHIF will be able to cater for the mammogram.
Oh, NHIF
Yes.
is catering for the mammogram?
Yes.
And CT scans and ultrasound?
CT scan, ultrasound, it depends with the category. Yes, but for the mammogram, for those who are civil servant, NHIF will be. And then the other insurances still, they are covering our mammogram services.
Yeah.
So don't feel fear of coming for diagnosis. Just take your time, come and visit us, diagnose your breasts to make sure that your breasts are clean.
Yeah, sure.
And if we detect any problem in early stages, then you'll be assured that you'll be treated and will be okay.
Yeah.
Yes.
Awesome. So thank you for a nice presentation. I
Welcome.
think next time you tell us about the CT scan, because I know the CT scan does a lot of things other than a mammogram, which is only meant for breast.
For breast, yes.
Yes, a CT scan will do a lot of things, and maybe the ultrasound and even the X-rays that we have here. You'll talk about it next time. Thank you so much for coming up for the show. We appreciate you. And people are asking questions, so I'll keep directing questions to you even after the show, because people are continuing to ask the
no
questions.
problem. They are welcome. They are all welcome.
Yes.
Yes.
So the charges for the mammogram?
Changes for the mammogram
They are
here,
friendly?
we charge around. They are friendly actually. Let me say they are friendly.
Yeah.
Around 4,000 to 5,000. Yes.
Okay. All right. So thank you so much, Dr. Thank you for coming through for the show. Thank you so
Thank
much,
you.
viewers, for showing up. You can keep sharing the conversation, because your friends, your relatives, and everyone, even your colleagues, needs to know about a mammogram. And if you are above 35 years or 40 years, you need maybe to be doing a mammogram maybe every year, so that you can be able
Yes.
to check your breast, so that you can be on the safer side. For all other services, maybe the CT scan services, ultrasound services, X-ray services, Dr. will be doing them to you, both at all our branches, at Ena branch, at Majimbo branch, Doctor's Plaza branch. You'll be able to receive all those services, radiography services, and you'll be helped in our hospital. Thank you so much for tuning in. It has been a pleasure. Until next time. So this is